Hi, I'm Dr. Sunil Richardson. I'm a maxillofacial and craniofacial surgeon practicing both out of South India and also out of the Middle East in the country of Muscat with Star Care Hospitals. I'm going to answer this very commonly asked question today, hopefully once and for all. That is, what about dietary restriction with regard to jaw surgery? Hundreds of questions being asked in different forms. I'm going to try and answer all of these in one go. Now, when you say jaw surgery, it means sometimes that you're moving the teeth that's on the jaws, and sometimes you're not moving the teeth on the jaws. Whenever the teeth are moved along with the jaws, so we do some osteotomies wherein that is done, and sometimes we don't move it. So when that is done, the first group, that is what I'm going to talk about first. So what is the immediate recovery? Those people wherein we move the teeth and try to get a different occlusion in jaw surgery, whether it be a Bimax surgery, a BSSO or any combination, we keep them on liquid food on day one. We don't keep their jaws wired at all, at no point in time. They are always able to open their mouth. From day 2 onwards, they are on soft, solid diet. This usually continues for 6 more days. So from the second week, they're usually back to 70% of the normal diet. Any food stuff that doesn't need much chewing but can be gently swallowed, little bit of chewing is allowed for the next 10 days. And after 2 weeks or 2.5 weeks, they can pretty much eat anything. This is what typically happens at Richardsons. Now, different centers, different surgeons, different protocols. I don't want you to get confused with what happens elsewhere. There are people I still know that wire their jaws shut. There are people I know that put them on 4 weeks of liquid diet. This is what we've been doing. We've been treating hundreds and hundreds of patients like this. We also do the surgery first approach. That's what we do here at Richardsons. And likewise, this is our dietary plan. Now, that was the first group when I said we're going to involve their teeth. The second group of jaw surgeries are those patients where we don't necessarily move the teeth. For example, we're doing an angle osteotomy, we're doing jaw sculpting, we're doing genioplasty, we're doing other procedures, we're not moving the teeth. For those patients, again, the first day is the same, liquid diet. Second day is also the same, soft solid diet. But they are on soft solid diet only for 4 or 5 days. And at the end of the first week, they can eat anything, pretty much. Again, diet that are not very chewy, very fibrous or very hard. These 3 foodstuffs we could avoid for next 2 weeks, but then they have less dietary restraints. One thing, however, that's common for all of these patients that undergo jaw surgery is this. Since the surgery is done from inside the mouth, since everything is done from inside the mouth, oral hygiene is of utmost importance. Definitely you got to keep your mouth clean. Mouthwash as required, as suggested by us, brush your teeth, and even oral prophylaxis. In fact, at Richardsons, we tend to do oral prophylaxis before we start these surgeries and also before they leave the hospital. This is because oral hygiene is of paramount importance. Once you make sure there's absolutely good oral hygiene, all these sutures heal up well, there's no infection, and everything goes smooth. And diet also helps in that. So I think it's clear now that when you are having a jaw surgery, depending on what type of surgery you're undergoing, if it's involving the tooth, then you have slightly longer periods of restriction. Otherwise, your restriction is very, very less. Thank you.